Hi everyone, and welcome to LSSA's Flight Conference. I'm Charlotte, and I'm a member of LSSA's Outreach Committee and a coordinator of our flight conference this year. In today's workshop, we'll be talking about exploring specialties within medicine with Dr. Kosack, who is a pediatrician at UCLA Mattel's Children's Hospital. Yeah, let's just go ahead and get started.
All right. Hi, guys. So I'm Dr. Kosack. I'm one of the pediatricians, like Charlotte said. I'm a pediatric hospitalist, which I can get into a little bit more what specifically that means. But just to kind of go through first kind of how I got to this position, I'll kind of explain what my pathway has been and then open it up to questions and can kind of go through kind of anything that you guys want to know. So I pretty much was interested in science, like probably many of you, from in like high school. I did some science research in high school, and that was my first experience working with a physician. I worked with a pediatric neurologist. And a little background, there's no one in my family that was in medicine at all. So I really had no idea what it meant to be a physician or even be in healthcare. I knew I was interested in science, and my high school had started this new like research program. And so I decided to take that class. I knew I was interested in like working with kids. I was interested in neurology at the time. And so I ended up reaching out, which as an undergrad, now that I'm in this position, understand or as a high school student, understand how hard it is to actually get in touch with a physician who will want you to help with research and involve you in that. And I got really lucky and had an amazing pediatric neurologist at Johns Hopkins who let me do research with him. And when we weren't doing research, let me shadow with him and kind of figure out what is life like as a pediatric neurologist, both on the outpatient side and when he saw kids in the hospital. So that was really my first taste of pediatrics and of really medicine. And then in undergrad, because I was continued to be interested in medicine. So I'm originally from the East Coast. I'm from New York. So I'm a transplant. I came here to California for med school at UCLA and kind of just never went back to the East Coast and became a big weather wimp. So I stood in Los Angeles. But in my time in undergrad, which I did at Barnard College, which is the Women's College of Columbia, I ended up getting involved in research with pediatric hematology oncologists at Memorial Sloan Kettering in the city. And I got to do research and chart review, which was a great experience. But then I also got to shadow and see like what it was like to be an oncologist. And I did some research the next year in undergrad working with a pediatric ophthalmologist, or actually an ophthalmologist who works specifically in oncology. So I got all of those experiences, and that's really what pushed me to want to go to med school. So I went to med school here at UCLA, and then I stood on to do pediatrics residency, which is 3 years at UCLA. And then I went away from UCLA for about 6 months and worked in a hospital at White Memorial as a pediatric hospitalist. And then I came back to UCLA. And if there's questions on like what a pediatric hospitalist is, we can go through that as well. But I kind of wanted to open it up. There's a long pathway to, as you guys have probably learned, and depending on kind of where you are in the process, into getting into medical school and then going further into residency. And I think when I did this as undergrad, I really had no idea what residency was, what fellowship was, what going into specialties was. And I kind of went very blind into it and found people that I was able to get mentorship for. So I think it's a great opportunity that you guys have to, in this conference is to kind of ask questions and kind of explore what things that you can also gain experience in to figure that out. I think the biggest thing in undergrad really is figuring out if you want to do if you want to go into medical school, if you want to go into the field of healthcare, and we can kind of explore why that is a little bit harder right now as well in terms of kind of getting those opportunities, which I think will start to open up soon for you guys in terms of being able to get some of those like shadowing and more hands-on experiences as well. So questions on that? I can keep talking and talking, but I want to make sure that I also address certain particular questions that you guys may have.
All right. Hi, also from the East Coast. I'm from New Jersey. Very well acquainted with Barnard, Columbia. That's kind of thrilling. I'm also slowly becoming a weather wimp. So how far into your process did you decide like what you wanted to specialize in? Because I do not know.
Yeah, and I think there's no reason to really know at this point at all. And even in med school, in first and second year. So most med schools are first and second year, you take, your classes. Certain schools have it where it's you take specific classes in the beginning, like organic chemistry specific things and categories like that. UCLA, for example, does it kind of in blocks where it goes more by kind of system based, and you do everything kind of, you learn cardiac and you learn pulmonary, all that together. And then typically the typical is third year, you go on clerkships, which means that you go all different types of specialties as a third year medical student. So you're on pediatrics and you're on surgery and you're on OB-GYN and neurology and so on. And so that's really where you figure out really what that specialty means, what it's like to be involved in the team, both outpatient and inpatient, and really get a sense of what are the things that you like, what things are you interested in, what kind of lifestyle certain fields, obviously every field is a little bit different from that perspective, and that's a huge thing that I think goes into lots of people's choices in addition to obviously their interests. So I think it's nice to have experiences and have interests so that also first and second year you can try to explore those things with people that you meet, but by no means do you need to know what you want to go into. There are people by the end of third year is really when you need to decide. And there are people even in the fourth year that are still trying to decide because they like so many things. Some med schools like UCLA this year, which I'm involved in, is changing over their curriculum where second year will be when you'll go into kind of figuring out going to all the other specialties, kind of like your third year. So you may get some experience even earlier. That's the goal for most of the newer curriculums, is to get clinical experience even earlier than kind of going into your third year. But yeah, but in terms of like personally how I figured it out, so I had those experience in pediatrics. So I was interested in neurology just kind of from a neuroscience perspective, and I had taken classes and I'd done a little bit of that research back in high school. And then I was interested in hemonc, and I ended up doing it in peds. So I'd had those experiences. So coming into med school, I was interested in pediatrics. I probably, I thought that's where I was going to go. But by no means did I know 100% because I really had absolutely no other experiences in any other field. So I really always say, like, keep a really open mind. So I always tell my students, like, when you're going into your third year, really just keep an open mind of what you like and then try to narrow it down. I ended up liking medicine as well. And I thought about, pediatrics medicine, and I felt like I would really miss out on seeing kids and working with kids. And I was okay, not working from a medical perspective with adults, but there are lots of similarities. There's a difference, I think, between kind of surgical fields and from a medicine side, like peds family medicine and in that perspective, that you get a little bit of more of a feel, I think, as you're talking with people and as you're kind of doing those rotations. But I have friends who went through all of the rotations and loved all of them. And so it was really hard to kind of figure out. But yeah, I think it's hard to figure that out and know what you want to go into because you've had no experience at all. And what you may like on paper and talking to someone about, and you're interested in the field, may not mean that when you go into that field and you're working with patients or you're working with kind of, if it's surgical or whatever, that you're going to necessarily fall in love with that area. And med schools don't by any means expect you to know like what specialty you want to go into. It's really, you do have an idea of what medical school is going to be like, in the sense that, you know, med school's hard. There's a lot of work. You will always be learning for the rest of your life. And that you kind of have an idea of what, you know, the healthcare field is, and more also for you that you've had maybe some experience to get a feel of what that's like. But by no means do you need to know what specialty. I think it's a really common question. I think also for some of the specialties that are a little bit more competitive, of like, how early do I need to know? Do I need to know like right at first year so I can start doing that research? All med schools will have like certain interest groups. So you can go to all these different interest groups and learn about that. You can approach people and approach mentors and physicians and think about what research and things you may like to do. And that's really, I think, exploring those areas of how much exposure you can get is what really is going to help you figure it out.
Awesome. Thank you so much.
Mm-hmm.
Did also oh, sorry, you go ahead.
Okay, did you ever consider going the PA route? And because I know that like physician assistants, they can like go into all the different kinds of specialties and like switch around a little bit. Do you think in that sense, like for me, I'm not really sure because I haven't really shadowed either one of them. And I don't even really know about all the specialties. So that's why PA sounds a little bit more appealing to me.
Yeah, I didn't. I think, yeah, as a PA, you definitely can be in different specialties as well. And I think PA is becoming, there are more PAs in different specialties depending on kind of also location in the country, also kind of what field that you're in. In where I work for peds, because it's in the hospital, we don't have as many PAs, but definitely on the outpatient side, there are some clinics that, you know, do have PAs as well. I never really thought about it, but to be honest, I think I just didn't have that exposure to it, as well. So I think kind of exploring that and asking more of those questions is always helpful. I think it's good opportunities, you know, once things open again in terms of shadowing, there's great opportunities to kind of see what the lifestyles are and the kind of those differences. I know it's hard right now in terms of kind of getting those experiences, and I know it's stressful because I talked to lots of undergrads kind of throughout this time during the pandemic, but just know everyone has had that. Like, no one has been able to get these experiences. I think that things will open up from volunteers and for sometimes also like community hospitals a little bit more than kind of academic centers to be able to kind of reach out and get that exposure. But I think even reaching out and talking to people and having those questions of kind of the differences and lifestyle change, like why they chose to go in that career, is also helpful, even if at this point you can't actually like get into the field and start going around. I think research is kind of how I got into medicine. I did some lab like bench research my first year after the summer after my first year in undergrad, and I was not a lab bench person. I did it and I was happy to not do it ever again. But I then kind of explored more of the clinical research and really just reached out to physicians, looked for programs that would have those opportunities. And it allowed me to kind of get into the thick of things in terms of the research and learn how how to complete research, but it also allowed me to, on the side, kind of shadow and talk with them, see what their life, day-to-day life was like, shadow them a little bit to kind of see patients, which gives you like a little bit exposure of kind of what it really is.
Yeah, that's really great to hear. Honestly, I was just personally wondering, like, even though it's kind of early to think about it, do you have any insight as to how, as undergrads or even after graduating before medical school, how we can kind of maybe kind of gauge what specialties would be best suited to us based on like our interests and like maybe personality or fit? Because I know it sometimes there's more to the eye to different specialties apart from just like the department itself. So I was kind of wondering if you have any insight to that, so we could kind of maybe look into like who to shadow and stuff, even though it's not like set in stone.
Yeah, I think the first thing, like at this point, since you haven't had as much exposures, I'd really go kind of what you're interested in or things that you're majoring in, or kind of what really sparks kind of, oh, I'm interested in neurology, and you reach out to someone in neurology, and that may take you down a different path, and then you end up really liking something else. So I think that's the first place to start. There definitely are different lifestyles in terms of the day-to-day activities, and then just lifestyle in general, which I think, as much as you of course go through like what you're really interested in, you have to consider those lifestyles in terms of, you may be there are people that are really, really interested in surgery and love it, but they don't want the lifestyle of kind of surgery, which is more kind of being in the hospital, obviously longer hours than maybe some other fields. And this is very general in terms of when I say surgical, because there's lots of different subspecialties within that field, but I just take that, for example. And then you have to think about from a lifestyle also, after med school, depending on what you want to go into, you apply for residency, and all residencies are a different length of time. So for example, pediatrics is 3 years. And then if you want to decide to go into a specialty of pediatrics, so let's say you want to do like pediatric cardiology, then that's another usually 3 years for most of the specialties. Our medicine folks are 3 years for residency too. But then our surgical field, some of them are 5 years, some of them are 7 years, and that's just your residency. And then you may do another specialty, and then you get to kind of being an attending. So that I think plays into it as well, kind of length of training time before you become an attending, and kind of that lifestyle. I think you kind of, the honest is like, you really don't know until you get that exposure. I knew I really was not a surgical person in terms of like wanting to do procedures and being like that from a hands-on perspective. So I think if you're interested in things like that, like exploring kind of some of the surgical is a good idea. But again, I had people that didn't think that they were going to be interested in surgery, and then did surgery during their med school and ended up loving it. I had lots of people and lots of med students that I mentor who are like, I'm not going to go into pediatrics. I don't want to see sick kids. I love, kids, and then they come and end up loving it and decide to go into that field. So I think at this point, kind of where you guys are, is to explore what you're interested in terms of kind of from a like topics and things like that, and then reaching out to people, doing these kind of conferences and learning and kind of trying to see if you can talk through kind of what your interests are, what their interests are. But I do think, shadowing is helpful, but again, it's only a very small, depending on what shadowing program you're part of, it may only be like a 1 day or like a very small time period, which is hard to get to really know what that field is. So if you can connect with someone and also do something that's maybe more prolonged, like get involved in some type of research or kind of program with them, that's going to allow you to kind of spend more time even in that field. I think any experience is great, even if it ends up like that is absolutely not what you're interested in, and that's not what you're going to go into. I think any of that experiences working with physician, learning about kind of day-to-day life, what it's like, if I take just example research, what it's like to do research, the professionalism of how to, you know, act in a hospital or a clinic are always good experiences as you kind of keep going on through the process.
Thank you so much. That was really helpful. Just like a tiny follow-up on that. Would you say that like within certain specialties, there are like maybe more opportunities to kind of say like maybe into research or kind of go into like the private sector, or which are more involved in the public sector, and like because I'm also kind of interested in like the intersection of medicine and business, so I'm trying to see like, yeah, which specialties would be great for that.
Yeah, I mean, I think definitely people do kind of even like MBA, or some programs like MBAs and MDs. A lot of people do like MPH and MD, or they'll, you know, do med school and do their master's of public health, or maybe do it the opposite way and do MPH first and then go into medicine. And so I think any field can kind of end up, you know, being useful for all of those in terms of from an MBA or like MPH, just to take for example. In terms of like private versus, I kind of would say like there's an outpatient side, there's an inpatient side. There are some physicians that do work outpatient and inpatient in either community hospitals or like what I work with in like an academic center. There are physicians that work in clinics that are federally funded, and then clinics that are private, physicians that are part of smaller groups, or even physicians that own their own practices. So for example, you know, family medicine is mostly an outpatient. So you see you see kids, you see adults, you see adolescents, you see everything. You can do a little bit of OB-GYN as well, but you generally don't go into the hospital as much to see them like when they're admitted to the hospital. OB-GYN, you do clinic on the GYN side and also obstetrics. And then if you're, you may go into the hospital and do deliveries, or you may consult in the hospital when there's an issue that comes up on a patient that's admitted. So you can do kind of a combo. Pediatrics, you can do that, you're just outpatient. So you're seeing well kids for their regular visits. You can do what I do, where I only see sick kids that are admitted to the hospital and I don't do clinic. You can do specialties where you're a pediatric oncologist and you see patients inside the hospital and outside the hospital. I think that works. Just kind of going general surgery, for example, they have clinics that are outpatient. It's probably less, there are some that obviously have private clinics as well. And there are many surgeons, most surgeons will be connected with a hospital, obviously, to do their surgeries, and then we'll see outpatient. They may work at a county hospital, they may work at an academic center. So there's lots of different combinations of what you can do. I think what I didn't realize really kind of going into this is even within a field, you know, you pick a field, let's say you pick pediatrics, for example, there's so much that you can do that's different. When you say like pediatrician, I think everyone thinks pediatrician, somebody who's seeing kids for their regular visits, the pediatrician that you went to and saw when you were a kid, but there's so much that you can do. You can do that. You can do what I do, where I'm just in the hospital. You can do a combination. There are pediatricians that I work with that do mostly research and only see patients, you know, a smaller percentage of time. So really you can do what you want and what really you're interested in, even within the field. There's differences, obviously, depending on if you do medicine, pediatrics, let's say, and surgery, of what things you can do just based on the field. But even within kind of each specialty, you can kind of do a little bit more. But in terms of your question, Charlotte, in terms of like MBA and MD, I think that may work in kind of many fields, and not necessarily like one particular specialty that you need to necessarily go into.
Okay, yeah, that makes sense. Thank you.
Dr. Kosack, I had a question. So you mentioned that you were the first in your family to really enter the world of medicine as a professional. What sorts of opportunities or tips do you have for first generation and low-income students to really build that opportunity where, you know, in medicine, in the media, you always see it's, you know, typically just white males. And how do I build that confidence to get my foot in the door and create my own opportunities where it's less accessible to me?
Yeah, great question, Nina. Yeah, I think what really helped me throughout my journey, and it still is true today, is really finding mentors, and really putting yourself out there and reaching out to people for those mentorships. I think I explained at the beginning, my first mentor was that physician who I found when I was in high school. And honestly, the way that I did it as part of my program, which when I think about it now, I'm surprised that I did it this way, but I literally just emailed physicians and I said I was a high school student and I was looking for research and this is what I was interested in and could I work with them? And I ended up getting very lucky finding this physician who wanted to take on a high school student and wanted to mentor me. And that really got me really passionate. And I think really also built my confidence that, okay, there are people around that want to do this mentorship. Then that got me interested when I was in undergrad to kind of look for programs that I could do more research. And then I found more mentors kind of within the HEMONC field. And that's really what built. I think the same thing held true in med school when I was trying to figure out what I wanted to do. It's held true through residency. And that's why I end up, now as a physician, really enjoy mentoring others. And so I work with undergrads and I work with, our medical students when they're in their first through fourth year and work with our residents, because I do think, if you don't have the exposure and you don't kind of get to have these discussions, then you really can't figure out what you want to do, because what you may think of what a physician is or what is on media or things like that is very different than I think the day-to-day life of what it's like to be even a physician, a nurse, PA, like me in the healthcare field. So I really would recommend just read, even when you're in undergrad, your professors, like people will be able to kind of show you that way. And there are, of course, people that you'll find that are good mentors and people that, may not work. And you have to kind of work on also what, that find that niche of like what, your personality and the person that's mentoring you and where they're really coming from and what your interests are and their interests are. So it may be that they're interested in something that has nothing to do with kind of their maybe like medicine side of it, and you got exposed to them through some other avenue, and that's kind of your first doorway in. And I will give Charlotte and Rohan my contact information because I'm always, open to talk with people and connect anyone, because I think that is really the only way that you're going to really be able to figure out really what you want to do going forward. And that may mean that you figure out you don't want to do medicine, which is also fine. I do another kind of undergrad program where they shadow in our hospital. And I always tell them, if you end up doing this program and you've shadowed with us and kind of learned the day-to-day, and then by the end you decide this is definitely not something I want to go into, that is also really beneficial and maybe even more beneficial because you've decided, you've looked into things and maybe this isn't the right fit. And then you kind of explore kind of what other interests you have. But I think mentorship has been huge for me and really able to get those connections and really see what's out there. And there's so much that you can kind of do. I think there's there's more now also of connecting, you know, there's some silver lining when we talk about like Zoom and pandemic, things like that, to be able to get in contact with people that you may not have been able to even like get in contact with as easily when everyone was kind of constantly in the hospital, when they even were not on shifts and things like that. And so I really do think that there are people out there that want to mentor, and it's just finding and reaching out.
Thank you so much. That was really helpful.
Yeah. Any other questions?
Yeah, I have a question.
Yeah.
How have you seen MPH degrees work together or like being applied to medicine?
Yeah, we have lots of people that have MPHs. I'm just gonna, you know, even in, you know, my field, which is pediatrics. And so I know a lot of physicians who do research and kind of work in the, some of our physicians like work in the high schools. They work on more of kind of the advocacy side as well. They work with, there's a physician who works also kind of in the prisons and like our juvenile patients. So lots of people use it for kind of the research side as well. And then also we have lots of physicians that do kind of more of the advocacy community work. I think it's really beneficial. Also, we have lots of like community physicians who, you know, work in our, obviously work with our communities and have that advantage after doing kind of this MPH, that they've worked in these communities, they know what the community needs. And really that's the main thing, right? What are the needs assessment of that community? And how do you help both from, you know, coming into clinic and seeing a physician, but then all the other things that go into it. I think just kind of concentrating on what I really know about in terms of kind of like kids and pediatrics, you know, you can come into clinic and you can tell them to do certain things, but if they can't do that in their community because they don't have that access to that healthcare, they don't have access to food or, you know, a majority of things that they need to do to be able to, you know, be successful, then you're not going to be able to get them to kind of go forward. So I think, you know, a lot of our physicians who have that experience doing MPHs can kind of add so much value to that. And not to say that you necessarily need an MPH to do those things, but I think you definitely get more experience and more time to kind of concentrate on that. And in lots of fields, not obviously just pediatrics in terms of MPH, but yeah, I think it's a huge advantage. I think a lot more people are thinking of or are doing MPHs and then applying it, and we're able to really have more resources that way and kind of better resources for our patients.
Thank you.
Yeah.
Did you ever consider anything aside from pediatrics? I know you got an early exposure to it, but during rotations, maybe was there a certain rotation that you were considering, oh, maybe pediatrics or this, and why did you? Yeah.
Yeah, so I went into third year and I told myself I would be really open and I would figure out what I liked. I had done bio as my major and psych as my minor. So I was interested in psychology and I was interested in kind of the neurology perspective because I had done kind of some of that research before, and I knew I was interested in peds. I thought I probably wasn't interested in a surgical field, but again, I had really had no exposure to it. So I ended up doing surgery first, and I did ped surgery that I could choose to kind of do some, and I liked the pediatric perspective part of it, but I didn't think I wanted to be someone who was in the OR and doing that. And then I did OB, and I found myself when I was in the deliveries wanting to be on the side where the baby was, which is a hint we always joke about when you want to go into pediatrics. And again, OB has some of the surgical, and I felt like I just didn't really enjoyed that. But then I did medicine after so I did pediatrics and I loved it, and I was like, this is what I want to do. And then I did medicine, where you're on inpatient, you're on outpatient, and there's a lot of similarities in terms of the thought processes that go on, especially on the inpatient side. What you do is when you're in the hospital, you do rounds where you talk about the patients in a group and you go through, could it be this diagnosis or that diagnosis? And so the thought process to go through that is very similar to what we do in pediatrics. And so I thought about medicine, and there's also, you can do actually a residency in medicine and pediatrics where you do a combination, where then at the end you could do medicine or peds, or there are certain fields like cardiology, for example, where if you do med peds, you can then do congenital heart, and you follow patients from baby to, when they're much older. So I ended up liking the medicine. I went to family medicine, which also had adults, but I knew I wanted a combination more of being in the hospital with sick patients. And then I did neurology and psychiatry, which neurology I loved more on paper, and didn't really enjoy it as much like when I saw it in patients. And then psychiatry, as much as I think it's, you need that kind of exposure, and I think it's an amazing rotation. I didn't see myself being able to kind of specialize in that. So I was between peds and medicine. And when I reflected back, I think I had to think, would I be okay not taking care of adults? Really is the big difference between peds and medicine. And I really just enjoyed working with kids. I think people always say, like, people that I know who are not in medicine are like, how could you work with kids that are sick? Kids that are happy and, not sick is one thing, but kids that are really sick. And then I work with kids that are only sick and in the hospital, because I don't see kids when they're well. But the resiliency of kids, even when they're sick and when they're in the hospital, is amazing. They are very honest, and they will tell you what they think, and they don't care what anyone else thinks, which is nice on a lot of days. And then, although I don't work with adult patients, our kids are obviously not living by themselves. And so I work with their families. And so I still get that interaction, obviously, with adults, and really being able to work with the entire family, which I really enjoy. So that was really the branch point was between, adults and kids. And I was fine not seeing an adult patient, again, in terms of taking care of them and really just concentrating on peds. I thought I was going to do pediatric hematology oncology. That's what I had experience in and research. And you get that exposure when you go into, after med school, and you decide to do peds, you go into peds residency, and you get exposure in all different fields within peds. And I ended up liking it, but not necessarily wanting to just focus on that. And then I ended up liking peds GI, and I was like, should I do that? And I didn't think I wanted to just focus on that. And so peds hospitalist, which was not a thing when I was in med school, or really had just started really in residency, at least on the West Coast, allowed me to see patients when they're in the hospital, and see lots of different subspecialties that that help me out when I think it's one diagnosis versus another. So I still get to take care of some of my hemonc patients and my GI patients, but I'm the person who kind of is taking care of the whole patient, and also, a little bit of a higher acuity. And so that's why I ended up going in that direction. But I have friends who went through third year and loved surgery and loved peds and loved medicine and loved this and loved that. And it's really then looking back of, you can love everything, but you see yourself doing it on a day-to-day. And then also taking into account, because I think, we talk about, obviously, you want to be interested in and you want to be passionate about it. And that needs to obviously be number one, because if you don't like what you're doing, you're not going to stay in that field. You're going to get burnt out, but you need to take into account for sure what the lifestyle is of each specialty. And then also what's the lifestyle of each specialty within specialties, because I have friends who are pediatricians outpatient and they work Monday to Friday, and maybe they're on what we call like mommy calls, where parents can call on Saturday and Sunday if they have questions, but they don't work in the hospital. They're not in the hospital overnight, as opposed to I am in the hospital during the day. Sometimes I'm there at night. I can work. Sometimes I'm working weekends, sometimes I'm not, but I don't see patients, outpatient. So there's lifestyle changes even within a field. But you have to take that into account. I have plenty of friends who love surgery, but they're like, I do not want the hours of what a surgeon's like, or they love psychiatry, but they didn't think that, that lifestyle was really what was going to work with their family life or whatever, is going on in their life. So you need to take that into account for sure.
Thank you so much. I think that advice applies to not only fields of medicine, but just life in general too.
Yeah, exactly. You need to take all of it into account. Otherwise, if you're just kind of concentrating on one thing, you're not going to be happy in it. And I think, when I did age myself, when I went into all of this, I didn't really have people explaining that to me. And it was kind of trying to figure this out on my own. You hear the stereotypes of like surgery and this field and that field. But until you really get to talk with people who are in that field, you really don't know what you can do. I think, the stereotype is that if you're a surgeon, you don't have a family life. I know plenty of surgeons who have kids and have a family and have so it really is talking to people that are in that field also that I think helps to know what that day-to-day and really what you can do within the field of medicine in general. But then obviously taking into account kind of where you are in your life and how that plays into it.
Do you ever get to touch upon preventative, like healthcare, like nutrition and epigenetics and things like that? Or do you know other people who are really interested in that too?
Yeah, I mean, many people go into pediatrics for preventative health. I mean, we end up, I think that's one of the big differences when people talk about like what field they want to go into. When people say peds versus medicine, for example, is that there are a lot of times adults already have these conditions and you're treating them, and there are of course things that you can prevent, but a lot of these things may have already happened, or lifestyle changes or things that happened to them when they were kids. And we get the unique experience to really start at literally like hour zero with our babies and really educating families. Nutrition is a huge thing that, we're always talking about both on the outpatient side and when we're on the inpatient side with our patients. Preventative health in terms of all of our screenings for our kids that when their babies go through, all of, huge thing which has come up obviously even more and more in the media now with COVID is vaccines and immunizations and that perspective of like a preventative. So I think not only in pediatrics, obviously is there that aspect, but I definitely, even though I'm in the hospital and not seeing kids on their well child visits, we still have a lot of things like that we talk about. We may have, admit a patient who may have come for, let's say, asthma, but the reason they had an asthma exacerbation is because either, mom and dad are smoking, or maybe it's because they live, near the freeway and that pollutant, or maybe they didn't have access to healthcare and they weren't able to get their inhaler. So all of those things definitely play into it. And so, yeah, it's definitely huge, especially in pediatrics where we're taking care of kids now.
Yeah, so kind of speaking of COVID, I was just wondering, like, if you kind of give us insight, like maybe a day in the life, pre-pandemic and also during the pandemic.
Post-pandemic.
Like, both.
Yeah. So, thankfully in pediatrics, although we've had kids that obviously have been positive and kids that have been admitted. It's not as much as on the adult side by any means. And kids have done pretty well. We have those complications that you may have heard of, like the MISC, where it's kind of, you know, even after COVID, that we've definitely seen. I think the biggest difference, you know, pre-pandemic, if I was not in the hospital on a shift, the way that my work is if I am in the hospital taking care of patients, I'm usually there from Monday to Sunday. It's like a week of what we call service time, where we take care of a group of patients, and I work with medical students and I work with residents, and I, you know, when we were allowed to have undergrads in there, we had undergrads as well, and volunteers. And when I was, and then sometimes I'm on night shifts, which for us is like 4 p.m. to 7 in the morning, where we stay in the hospital and we take care of patients and we admit patients from the ER. So all of that stood the same in the sense of like, I was still taking care of patients. Obviously in the pandemic, we were still seeing kids in the emergency room. Most of the differences were obviously the precautions that we were taking. Biggest differences also were a lot of our visitor policies. You know, we used to have like the whole family would come. And we had one point where, you know, only one person can come, or only one, you know, one person also could stay overnight. Now we thankfully have expanded, and now, you know, 2 people can be in, but now it's only 2. It used to be, you know, there wasn't a certain amount of people that could be in their room. When we talk about kind of on the inpatient side. The other big difference is that usually if I wasn't in the hospital, I was still, or I wasn't on service, I was still in the hospital, like in the office with other pediatricians, some that maybe work as outpatient physicians, some that work in the hospital doing my other work. So when I'm not on service, I do, you know, research and some, you know, committee work in like patient and family centered care. And so I usually was in the hospital with other physicians. And now, at least during the pandemic, if we really were not on a shift, then we were at home and we were doing lots of things like you guys are doing, and lots of our calls were all through Zoom. That's really that's the big difference, is that when we're not in the hospital, a lot of our things have been kind of converted to kind of a remote. And then of course there's not as many gatherings. I think, you know, it's fun to be in the hospital. That may sound weird, but you know, there's a community, and you're seeing your nurses that you work with, and your residents and physicians, and we had to think obviously a lot about social distancing and not gathering in groups, and trying to be creative with using Zoom with families and having limited amount of people, you know, at the bedside. So that was kind of the biggest difference kind of in the pandemic. For people on the outpatient side, which is a little bit different, pre-pandemic, everything was you go into the clinic and you see your physician, either for your general pediatric well care, or maybe it's a specialty. And when the pandemic hit, we, you know, obviously we're encouraging people not to come to clinic if they didn't need to come to clinic. And so we ended up transitioning a lot of things to telehealth, like the adult side did as well, where we would see, you know, the outpatient physicians would see the patient, so the child and the parent, over, you know, the telehealth, Zoom, wherever you want to call it, and would only tell them to come in if they really needed to come in. So that was a huge change. We really, you know, we maybe did a little bit of telehealth for some fields that really didn't need patients to come in, but we really didn't explore that at all prior to the pandemic. And now I think it's definitely something to stay. And I think there's definitely there's advantages to it, and there are disadvantages to it. And we've transitioned back to patients that really need to come into the clinics will come in. But we have lots of kids that live really, really far away. And there are certain things that you can do over telehealth that you don't necessarily need to come into the hospital. And I think we'll hopefully also gain that access to healthcare to people that are even further, you know, away and can't necessarily come in. So those are some of the differences, at least for us on the ped side of.
Yeah, I think really with this pandemic, it's kind of taught all of us how to be more like resourceful, and kind of realize how many things we can kind of do ourselves, or like make do by ourselves, if that makes sense. Yeah.
I mean, I started doing what we do is called like family-centered rounds on pediatrics, where we stand in front of the door where the patient is, and all the physicians, med students, residents, myself, nurses, the social workers, nutrition, everyone was around. Like, there was a ton of people. If you kind of like think about on TV, like all the people that are around a bedside, it's a little bit, it's different than that, but think about, there's so many people that are involved in these multidisciplinary field. And we had to stop that because there's like in the very beginning, and we're starting to go back, but we then needed to figure out ways, how would we make sure that we're providing the same care to these families and they're able to still hear from everyone. And so we created Zoom rounds where we go with the computer and everyone else is on the screen and only a couple people are at bedside. And there's been, some advantages that I think we're going to use going forward, which is one of my projects. And so we will, some of our ancillary staff that can't be at the bedside, families that can't be at the bedside and stay with their child because they have to work, but maybe they're able to kind of Zoom in and still be able to be part of that conversation. We have interpreters that are able to get on the screen and talk with families. So there's definitely, there's lots of things that we're very excited going forward. We will go back to as per usual, but I think there are lots of things that we definitely will use. And I've been able to connect with people doing research kind of, even not in my own institution, even easier than, obviously having to always get together and do those things that are a little bit hard depending on everyone's schedule. And, Zoom has made that, a little bit easier. I think everyone will be happy to see each other, like actually see each other. But yeah, there's definitely been some silver lining.
Yeah, I agree.
Any other questions? And again, I will give my contact, or Charlotte has my contact, and you guys can reach out if there's things that come up kind of after, or questions that you have, and how I can be of help also to find you guys resources. If I don't know the answers to your questions, or you're interested in a certain field or certain interests, and connect you with people that would be able to kind of help.
I guess one question that we can ask is, did you ever feel imposter syndrome, and how did you deal with that? Especially since in medicine, a lot of professionals are lifelong learners. How do you tackle that sort of feeling?
Yeah, I think I still feel imposter syndrome now, for sure. And we talk about this a lot, for our med students, and I work with first year medical students who are just, starting, and there's definitely a lot of that of, will the patient feel like, am I allowed to ask these questions now to a patient and go in like, am I their physician, and really taking ownership of that? And it's so hard, I think, in the beginning when you're at that step. But I think there are, when you keep going on and further, and we talk about this in our threads as, pediatric hospitalists as well, there's kind of that imposter as well. I think, how do you tackle it? Again, I think people who are also encouraging you as you're kind of going through the process, when you're in med school, and having those mentors and gaining that confidence is huge. I think talking to people in the field and to physicians about it. I think all of this imposter syndrome, burnout, and it all existed. It's not like there's these new concepts that all of a sudden this is here now. I think people just didn't talk about it. And so I think now that we are talking about it, we find ways to, deal with those challenges. And I think there's a huge advantage to also know that other people are feeling the same way. And that is really also what has helped me, is that, it's not just me that's feeling like this, and then what do I do with it going forward, and how can I be more confident, or who can I reach out to kind of figure out. I think being a woman in medicine is a whole other aspect to it as well, and that also depends on your field in terms of subspecialty of are there kind of just saying women in that field. And so I think we've definitely done better in terms of increasing women, even in fields that in the past really did not have as many women in there. But it's a huge you know, thing that we talk about all the time in terms of imposter. And I don't think it really ever ends, probably, that, but I think talking about it and really figuring out truly what are those challenges and really what is happening is probably the big key to it. And I always tell my med students, like, you really need to have that confidence. Like, yes, you got into med school and you've done all this work and we've worked together, and like, you can go see a patient and have that ownership. And that's like easier said than done, obviously, when you're first starting. But I think having people encouraging you that way is also super helpful, because you know that it's something that's attainable and they've done it as well.
Yeah, thank you. So just like really owning that feeling and taking ownership and not letting it take control of you. Yeah.
Exactly. Yep.
Thank you.
Mm-hmm.
So if those are all the questions, I think we can begin wrapping up because it's almost getting to 11. But I just want to say a huge thank you to Dr. Kosack for taking the time out of her day to really give us really valuable insight into the pediatric field as well as other specialties in medicine. I think I can kind of say on behalf of everyone how helpful this has really been, and really gives me a different perspective on how to approach med school in general and just like the medical field. So yeah, if you guys have any more questions, feel free to stay on and ask. But if not, one thing I'll say is, especially if you came late, I'd like to invite you all to come to today's post-conference social. It's at 5 p.m. and it'd be a great way to kind of get to network with everyone, like all the speakers in the conference and also other LSA members and other students. So I'll put the link in the chat if you want to come. But yeah, thank you all so much for coming.
Guys.
Thank you.
Thank you so much.
Thank you, guys.
Thank you, Dr. Kosack. Thanks, Charlotte.
Thank
I'll see you
Yeah.
soon.
No
Bye.
problem. Yes, see you.
Oh, don't forget to stop the recording so it's not lost.
Oh yes, okay.
Have a good one, guys.